Experiment. Effect of topically applied ocular drugs on rabbit eye. Aim to demonstrate and evaluate the actions of miotics, mydriatics, cycloplegics, and local anesthetics on the rabbit eye using 5 standard parameters. Principle. The autonomic innervation of the eye controls pupillary dynamics and accommodation. Spinster pupillae M3 contracts pupil meiosis. Dilator pupillae alpha 1 dilates pupil active mydriasis. Ciliary muscles M3 controls accommodation. Contraction is spasm of accommodation and paralysis is cycloplegia. Corneal sensory innervation V1 mediates the corneal reflex. Local anesthetics block voltage gated sodium channels, abolishing this reflex. Parameters observed and methods. There are 5 parameters: pupillary size, light reflex, corneal reflex, intraocular pressure, and accommodation and photophobia. Pupillary size mm measured using papillometer under constant ambient light. Second is light reflex. Torchlight shown from the side onto retina. Normal constriction present. Corneal reflex. Corneosacral junction touched gently with a fine cotton wisp. Normal blinking present. Intraocular pressure IOP measured by Schiot's tonometer. Impression tonometer. Fifth is accommodation or photophobia. The loss of light tolerance indicates mydriasis. Photophobia. Inability to adjust light focus indicates cycloplegia. Drug-wise observation summary. Exam tables. TE test eye where drug is used. CE control eye where normal saline is used. Plus means response intact or present. Minus means lost or absent response. Table A where we are using atropine 1%. It is an anticholinergic parasympatholytic drug. Mechanism. Competitive antagonist at M3 receptors in spinster pupillae and ciliary muscles. Baseline at t equal to 0 for test eye and control eye. The parameters: pupil size 2.5 mm, light reflex positive, corneal reflex positive, IOP normal, cycloplegia and photophobia not seen. With atropine 1% drug post installation t equal to 30 minutes, pupil size has increased 5.5 mm, mydriasis, light reflex negative, corneal reflex positive, IOP has increased, cycloplegia photophobia is marked. When using atropine 1%, we see in the test eye compared to the control eye, pupil size there is passive mydriasis, light reflex is positive, blocked due to spinster paralysis, corneal reflex is positive due to intact sensory nerve as unaffected, and IOP has increased because drainage compromised by iris fold, and cycloplegia photophobia paralyzed ciliary muscles. Table B phenylephrine 5% adrenergic sympathomimetic. Mechanism selective alpha 1 agonist on dilator pupillae muscle. Parameters: baseline at t equal to 0, test eye and control eye. Parameters: pupil size 2.5 mm, light reflex present, corneal reflex present, IOP normal, no cycloplegia or photophobia seen. After phenylephrine 5%, post installation 30 minutes, pupil size 5 mm, light reflex positive, corneal reflex present, IOP decreased or unchanged, cycloplegia photophobia is absent. So pupil size, we can see the active mydriasis, light reflex is intact, the spinster muscle active, corneal reflex intact, IOP facility of outflow slightly improved, cycloplegia, ciliary muscles unaffected, M3 intact. Table C pilocarpin 2% direct muscarinic agonist. Mechanism direct M3 agonist causing spinster pupillae and ciliary muscle contraction. At baseline t equal to 0 minutes, test eye and control eye. Pupil size 2.5 mm, light reflex present, corneal reflex present, IOP normal and no cycloplegia or photophobia. Post installation 30 minutes. Pupil size 1 mm, marked meiosis, light reflex intact, corneal reflex intact, IOP reduced, pulse sclerals per opens trabecular meshwork, cycloplegia photophobia is there is a ciliary muscle contraction, spasm of accommodation. Table D lignocaine 4% local anesthetic. Mechanism block voltage gated sodium channels halting sensory conduction along the trigeminal nerve. Baseline t equal to 0, test eye and control eye. Pupil size 2.5 mm, light reflex intact, corneal reflex intact, IOP normal, no cycloplegia, photophobia. Post installation, T equal to 15 minutes. Only corneal reflex absent, abolished, corneal surface desensitized, and all other parameters unchanged. Master comparison, drug class, anticholinergic, atropine, massive pupil dilation, loss of light reflex, corneal reflex, adrenergic agonist, phenylephrine, pupil size, dilation, light reflex positive, corneal reflex positive. Direct parasympathomimetic, pilocarpin, pupil size constriction, light reflex intact, corneal reflex intact. Local anesthetic, lignocaine, pupil size unchanged, light reflex intact, corneal reflex lost. Accommodation, anticholinergic drugs cause cycloplegia, direct parasympathomimetic drugs cause spasm, intraocular pressure, anticholinergics increase, adrenergic agonist decrease, direct parasympathomimetic decrease intraocular pressure, and for local anesthetic IOP is unchanged. Conclusion, atropine produces massive mydriasis with cycloplegia and loss of light reflex. Phenylephrine produces active mydriasis without cycloplegia, light reflex remains intact. Pilocarpin produces meiosis with ciliary spasm and lower IOP. Lignocaine selectively abolish the corneal reflex without altering pupillary dynamics.